Have you ever felt a creeping anxiety as you began to notice subtle, yet concerning, changes in your loved ones over the past year? We often tend to think that passing away in old age will come suddenly, like an unexpected storm. But the truth is, the human body often sends out silent warning signs, sometimes months, even a year, before life comes to an end. The problem is, we often overlook these signs because they seem small and insignificant. Only when we look back do we truly realize that those clues were always there, right in front of our eyes. But by then, it may be too late to prepare adequately, too late to create truly meaningful and valuable final moments and memories. Today, we'll explore 5 important signs that often appear a year before an elderly person passes away. Some of these signs may be things you've already noticed, but dismissed as just a part of the natural aging process. Other signs may be small changes, but in reality, they signal a gradual decline of the body. Recognizing these signs early will give you opportunities to provide better care, cherish meaningful moments, and most importantly, ensure the final stage of your loved ones' lives is filled with comfort, dignity, and peace of mind. Stay with me until the end of this video, because these 5 signs can help you prepare emotionally and practically for what's to come. When you understand what's happening, you'll no longer be caught off guard. You'll be able to make the most of the time you have left with those you love. I've witnessed these things happen in my own family, and I truly wish I had known this information sooner. I hope that this video will help you and your family better prepare for the final journey of your loved ones. Now let's get started. Significant weight loss, an early warning sign to watch out for. One of the earliest and most obvious signs that a person may be approaching the final year of their life is unintentional weight loss. Initially, it may appear very subtle and difficult to notice. The belt they usually wear suddenly needs to be tightened a notch, their clothes become looser than before, or their appetite begins to decrease. Many families often overlook this, assuming it's just part of aging. But the truth is, losing weight without trying is rarely a good sign. It often indicates that the body is no longer able to absorb nutrients as effectively as before, muscle mass is gradually decreasing, and essential body systems are slowing down. Natural aging will lead to some muscle loss, but when this happens too quickly, it's a sign that something deeper is going on. The body may be struggling to digest food properly, or the person may no longer be able to process protein efficiently, leading to muscle atrophy. This decline in strength not only makes it more difficult to move, but also increases the risk of falls, weakens the body's immune system, and makes the person more susceptible to infection. Imagine old Mrs. Eleanor Vance, who used to be a very active gardener, but now even walking around her house has become extremely difficult. Another reason for weight loss in the final year of life is a change in appetite. Many elderly people simply don't feel as hungry as they used to. Their sense of taste fades, food no longer tastes good, and they may start skipping meals or eating only very small portions. This isn't just a matter of personal preference, it's a physiological change. The body, sensing that it is beginning to shut down, no longer sends signals to the brain to seek food as often as before. As a result, they have less energy, less strength, and a gradual decline in overall health. And then there's the role of underlying medical conditions. Weight loss is a very common symptom of chronic diseases, such as cancer, heart failure, or kidney disease. All of these conditions can begin to progress long before more obvious symptoms begin to appear. Even conditions like depression or cognitive decline can lead to decreased eating, creating a downward spiral where the body no longer receives enough fuel to function. Some families often try to address this by encouraging their loved one to eat more, offering their favorite foods, or supplementing meals with protein drinks. But if weight loss continues despite these efforts, it's important to recognize that the problem isn't just about diet. It's that the body is preparing for a deeper transition. At this stage, forcing large meals may not help much. Instead, focus on comfort, easy-to-eat foods, and adequate hydration, which can make a bigger difference in maintaining their quality of life. I remember the case of Mr. George Humphrey, who used to be a talented chef. He always felt proud of the delicious meals he created, but in his final months, he could barely swallow anything. The family tried to force him to eat, but it only made him feel more uncomfortable. Eventually, they sought out a nutritionist and were advised to focus on soft, easy to swallow, and nutritious foods. This helped him feel more comfortable and maintain some strength. Important advice: if you notice significant weight loss in your elderly loved ones, especially if they are eating less, feeling weaker, or having difficulty maintaining daily activities, it's time to pay attention. This isn't just about appearance. It's about the body sending you a message, and understanding that message now can help you prepare for the road ahead with clarity, compassion, and the ability to make every moment count. And don't forget to consult a doctor for the best advice and support. Extreme fatigue and weakness when energy runs out. One of the most noticeable changes in the year leading up to the final days is a deep and persistent fatigue that doesn't go away even with adequate rest. It's not just feeling a little tired after a long day. It's a deep exhaustion that makes even the simplest tasks overwhelming. Getting out of bed becomes a major challenge. Walking across the room requires a huge effort, and activities you used to find familiar, like cooking, getting dressed, or even talking, start to feel too tiring. This is not just the result of natural aging. It's a sign that the body is trying to conserve its remaining energy. As organ function begins to slow down, the body begins to prioritize what's truly essential. The heart no longer pumps blood as efficiently as before, circulation weakens, and muscles no longer receive the same amount of oxygen as before. This is why many elderly people in their final months often feel weak, unsteady, and unable to maintain their previous activity levels. Another important factor is the slowing down of metabolism. The body is designed to produce and use energy, but as it prepares for its final stage, that energy is redirected. Instead of fueling activities, the body switches to conservation mode. This is why a person in decline may start sleeping more, needing longer naps during the day, and finding it difficult to stay awake. Some people may even experience sudden drops in energy. They may look fine one moment, but be completely exhausted the next. But perhaps the most heartbreaking part of this process is the emotional impact of fatigue. Many elderly people who once prided themselves on their independence now begin to feel frustrated or even ashamed because they can't do the things they used to do. They may withdraw from conversations, avoid social interactions, or stop participating in hobbies they love. It's not that they no longer care. It's simply that they no longer have enough energy. This can lead to a vicious cycle of isolation, where they stop trying altogether, and this only accelerates the decline. For families, watching their loved ones transition from active and engaged individuals to exhausted and withdrawn ones can be very painful. It's easy to assume they're just being lazy, or that they need to try harder to get over it. But the reality is, forcing them to be active won't help. The most important thing is to understand their limitations, allow them to rest when needed, and make their remaining days as comfortable as possible. I remember the story of Agnes Miller, a talented artist. She was always full of energy and passion for painting. But as her health began to decline, she became increasingly tired. She could no longer stand for long periods to paint, and she frequently had to rest. Her family tried to encourage her to keep painting, but it only made her feel more frustrated. Eventually, they realized that the most important thing was to let her rest and create a comfortable environment for her to relax. Important advice: if you notice your loved ones experiencing deep and constant fatigue that doesn't improve with rest, take it as a sign that their body is undergoing a major transition. This is a time to cherish conversations, create peaceful moments, and support them without any expectations. Because in the end, what matters most is not how much they can do, but that they feel loved, understood, and comfortable. Always create a comfortable and quiet space for them. Increased confusion or withdrawal when the mind gradually fades. As a person approaches the final stage of life, one of the most noticeable changes we may see is in how they think, communicate, and interact with others. You may notice that someone who was once sharp and engaged now begins to forget things more often, has difficulty following conversations, or seems disoriented in familiar places. They may repeat themselves, forget the names of acquaintances, or lose track of time, even if they never had any memory problems before. These subtle cognitive changes can occur months or even a year before they pass away. This is more than just the ordinary forgetfulness of life. The brain, like any other organ in the body, requires a steady flow of oxygen and nutrients to function properly. But as the circulatory system weakens and the oxygen supply to the brain declines, cognitive function will begin to deteriorate. The person may become easily confused, have difficulty making decisions, or struggle to recognize people and places they've known for many years. In some cases, they may even have brief moments of clarity, followed by sudden episodes of confusion, almost as if their mind is fading in and out. Another common sign is emotional withdrawal. A person nearing the end of life often tends to lose interest in social interactions. You may notice that they talk less, participate in fewer activities, or spend a lot of time just sitting silently alone. It's not that they no longer care about their loved ones, but that their brain no longer processes emotions and engagement in the same way as before. Conversations become very tiring, noisy environments feel overwhelming, and eventually, many elderly people withdraw into their own world. You may also notice changes in their mood and behavior. Some people may become more irritable, anxious, or easily frustrated. Others may seem unusually calm, detached, or indifferent to things they once cared deeply about. This isn't just a change in personality. It's often the result of the brain adjusting to adapt to the decline of the body. As cognitive function slows down, emotions become harder to express, and the person may stop reacting to situations in the way they used to. For family members, this stage can be particularly difficult. Watching their loved one lose touch with reality or withdraw emotionally can bring a feeling that you are losing them before they are actually gone. But it's important to remember that this isn't something they can control. Instead of trying to bring them back to conversations, the best thing you can do is meet them where they are. Speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. I remember the story of Walter Hayes, a retired history professor. He used to be a very intelligent and knowledgeable man. He always had an interesting story or anecdote to share with everyone. But as he began to decline, he became increasingly forgetful and confused. He often forgot the names of the people around him, and he had a lot of difficulty following conversations. His family was heartbroken to see him like that, but they tried their best to support him and create a comfortable environment for him to relax. Important advice: if your loved one becomes more forgetful, confused, or less engaged, don't ignore those signs. These are often early signs that their body and mind are preparing for the final transition. This is a time to be patient, cherish the quiet moments, and focus on creating an environment where they feel safe, familiar, and at peace. Because even when words fade away, love and comfort can still be felt. Create a quiet and familiar environment for them. Frequent infections and slow wound healing. When the immune system weakens. As the body begins to weaken, one of the most obvious physical signs is a weakened immune system. You may notice that a person who rarely got sick before now seems to catch everything, from colds and flu to minor infections. Illnesses that used to be mild now take a long time to recover from, and simple wounds, such as a small cut or a bruise, heal at a significantly slower rate than before. These changes are not random. They're signs that the body is no longer able to protect and repair itself as it once did. One of the biggest concerns is repeated infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become much more common when the body's immune system weakens. Many families assume these are just individual illnesses, but when they start happening frequently or could take too long to heal, it's often a sign that the body is losing its ability to fight off disease. Even antibiotics, which used to work quickly, seem less effective. The patient may need stronger medications, longer recovery times, or more rounds of treatment for infections that used to be very mild. This happens because as circulation slows down and organ function declines, the body simply doesn't respond to treatments as well as it used to. Another problem that is often overlooked is chronic wounds. If you notice that small scratches, sores, or bruises don't heal properly or keep opening up, it could mean that their circulation is impaired. Poor blood flow means that oxygen and nutrients don't reach the skin and tissues effectively, making the healing process much slower than normal. Bed sores, especially in people who are less active, become a very serious risk and can lead to very dangerous infections if not managed carefully. What's even more concerning is that infections in the final year of life often don't look the way we expect them to. Instead of a high fever, an elderly person may just seem more tired than usual, more confused, or less interested in eating. In fact, for elderly people, a sudden decline in mental alertness is often the first warning sign of an infection, even before other symptoms appear. This is why recognizing these changes early can make a huge difference in how much comfort and support they receive in their final stage of life. For families, watching their loved ones experience repeated infections can be very distressing and heartbreaking. It's tempting to push for aggressive treatments and hope that another round of antibiotics or another hospital stay will solve the problem. But at a certain point, the focus will often shift from curing the disease to alleviating the pain. Ensuring that they are adequately hydrated, keeping their skin clean and moisturized, and minimizing stress on the body may offer more health benefits than using another round of medication, which only prolongs their suffering. I remember the story of Beverly Chapman, a strong woman who had survived many illnesses. But in her final year, she kept getting urinary tract infections. Her family took her to the hospital again and again, but the infections kept recurring. Eventually, they realized that the most important thing was to make her comfortable. They made sure she was adequately hydrated, that she received the best skincare, and that she was in a peaceful environment. Important advice: if you're still watching this video and find these details valuable, please comment the number for below to let me know you're here. And if you haven't subscribed yet, I encourage you to subscribe to my channel now and turn on notifications so you don't miss any videos. Your support will help me continue to create good content to inform and inspire everyone. Always remember to keep the body clean and moisturized, and don't forget to create a comfortable environment for your loved ones. Major changes in breathing or circulation when the body slows down. One of the clearest signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. You may notice that your loved one is breathing slower or shallower than before. Sometimes they may pause between breaths, or their breathing may become irregular, speeding up, then slowing down unexpectedly. Some people may experience a rhythmic, gentle breathing pattern called Cheyne-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. These changes may start very subtly, but over time, they become more pronounced and frequent. Another common sign is weakened circulation. You may notice that their hands, feet, or even their nose and ears start to feel cold to the touch. The skin may appear paler, have a slightly blue color, or show mottling, especially around the fingers and toes. This happens because the body is prioritizing blood flow to the vital organs and reducing circulation to the limbs. It's a very clear sign that the heart is no longer pumping blood as powerfully as before. Some people will also experience more shortness of breath, even with very minimal movement. Just sitting up, talking, or changing position can make them feel breathless or out of breath. You may notice that they breathe through their mouths more often, or that they may suddenly need to stop and catch their breath while talking. If they used to be able to walk across a room easily, but now struggle to do so, their lung function may be declining. In some cases, fluid buildup in the lungs can make breathing more difficult. This can cause persistent coughing, gurgling sounds, or even a feeling of chest tightness. Many people will assume it's just congestion from a cold, but for elderly people nearing the end of their lives, it's often a sign that their lungs are weakening. This can make it very uncomfortable to lie flat, and they may prefer to sleep propped up with pillows or in a recliner to make breathing easier. For family members, witnessing these changes can be very frightening. It's natural to want to help them, encourage them to take deeper breaths, or worry that something urgent is happening. But in many cases, this is simply the body's natural way of slowing down. There may not always be a way to reverse these changes, but there will always be ways to help them feel more comfortable. Keeping the room cool, using a humidifier, or giving them small sips of water may help reduce discomfort. In some cases, medication or oxygen therapy may also provide some relief, but the focus will shift to comfort rather than trying to solve the problem. I remember the story of Harold Nelson, a passionate mountaineer. He'd spent his life exploring mountains, but in his final months, he became increasingly short of breath. He could no longer walk even a short distance without feeling tired. His family was very worried, but they realized that the most important thing was to make him comfortable. They made sure he was in a cool room and that he always had enough oxygen. Important advice: if you notice these signs, such as changes in breathing, cold hands and feet, or bluish skin, pay attention to them. These are often signs that the body is trying to conserve energy and that circulation is slowing down. It's a time to be present with them, offer reassurance, and create a peaceful environment where they feel safe and comfortable. Always keep their space as comfortable and airy as possible. As we come to the final lines of this article, let's take a moment to reflect on what we've discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often appear in the year leading up to the passing of an elderly person. They may not all happen at the same time, and they may not always be obvious from start. But when you start to notice these signs, it's an indication that the body is preparing for its final transition. For many families, these changes can be very difficult to accept. It's natural to want to fight them, encourage your loved one to eat more, move more, or try to overcome the exhaustion. But sometimes the best thing we can do is listen to what their body is telling us. Instead of focusing on trying to reverse the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs is not about fearing death. It's about preparing for it. When you recognize these changes early, you can take better care of them, make important decisions ahead of time, and ensure that the final months of your loved ones' lives are filled with love,